Hello and welcome. My name is Donna Cryer. I am the founder and CEO of the Global Liver Institute, and I have the honor of being your host for GLI Live. Our method of communicating important information and topics and have really crucial conversation with experts like my guest today. For the benefit of the liver community worldwide and just people who are interested in promoting liver health. And so today I have with me who I think is a really, really special guest because he's been a particular friend to the Global Liver Institute, someone I learn from both in this field of how to connect NASH and obesity, but also just as I become a more effective advocate. I always take notes when I'm with Joe Nadglowski from the Obesity Action Coalition, and Joe and the coalition were one of the earliest members of the GLI NASH Council, and so I thank him for that faith and partnership from that day to this. So welcome, Joe.
Thanks, Don. I'm excited to be here.
So the title of today's episode is weight bias and stigma, but I really think of this as the conversation that people don't know how to have, should be having, honestly, I'm so grateful so many people are trying to figure out how to have in a way that is, productive and, supportive of people rather than stigmatizing and counterproductive as perhaps conversations about weight loss and obesity have been in the past. So I grateful for everybody who is listening as we do this live and who will be viewing this, with an open heart and an open ear on how to navigate this for themselves or on behalf of their patients or loved ones. So Joe, one of the questions that I have is sometimes this conversation is often very all or nothing. It's either this is completely under somebody's control, often their fault. And it's just they just need to lose weight, just diet and exercise, and that'll do it. It's a lack of willpower, whatever like that. Or on the other extreme, it's totally people are powerless. It's just genetics. I think anything that starts with the word "just" is often wrong. It's usually wrong. Or it's just genetics. It's just environment. It's nothing people can do. So somewhere on that spectrum between hopelessness or empowered and hopeless is the truth. I'm thinking. So how have you and the Obesity Action Coalition helped to shape our approach to this work?
So thanks, Donna. I think this description of obesity that you tried to there does reflect societal's views, right? We have a lot of people in society now. Actually, we did a big study that actually shows more and more people actually are recognizing obesity as a disease, but most people still think it's all their own fault, right? And I think we have this issue. So this fault issue becomes at that. And obesity really is a complex disease, one that involves genetics. It involves your environment that you live in. And then, of course, it does in some ways involve behavior. Of course, what many people think it's all about behavior, right? And it's definitely not all about behavior. It is so much more complicated than that. And I think representing this complexity and understanding this complexity is important for someone who lives with the disease of obesity. A lot of us have internalized the attitudes that live in the public, and we blame and shame ourselves about our body. And our body size, and don't think it's okay to actually ask for help from a qualified healthcare professional to help you with your weight. And I think, on the other side of that, a lot of times, if we do work up our courage to have a conversation with a healthcare provider about our weight, we often get the finger wag and that just says you just need to lose some weight, right? Instead of them actually offering us kind of the evidence-based options to move us forward. And so, us being afraid to have that conversation is part of that bias. And then when providers don't have the skill set to be able to care for us, it's part of that bias as well. And then it creates all these attitudes that you described right there, right? Because the public is frustrated, right? So we either blame ourselves or we say there's no hope, right? And we get caught in between. And of course, our goal is to make sure that people understand that you're not alone in this. There are many of us that live with obesity that have faced the struggle, and that there are evidence-based options out there if you're ready to do something about your weight and your obesity.
And so what are some of those evidence-based, options? What are the tools that are available to someone who does to, start reducing their excess weight?
Yeah, so I mean, the evidence, there's solid evidence across a number of spectrums. So you really can think of the behavioral programs, which is you working with a dietitian, or even using one of the community health programs like what they offer at WW, or at the diabetes prevention program at the YMCA, which really is a weight management program, right? And these are all evidence-based. They have randomized, clinically controlled trials that are out there that do that. And then you can move beyond the behavior and to some of the medical therapies. And so you can actually see a specialist for obesity. They're called obesity medicine specialists, and they actually can prescribe medications. There are several FDA medications, and we have even better ones coming soon. And then there's bariatric surgery, which often gets perceived as kind of the procedure of last resort. But I would really encourage people to think about all of these procedures earlier, right? Don't struggle so long on your own trying to do this when we know there's good help out there. You shaming yourself thinking that it's not okay that I ask for this help is part of the problem. And so, no matter what that therapy is, I would encourage people to go sooner rather than later to talk to their providers about what options are available.
So why would people want to lose weight?
Yeah.
As we were talking in the pre-show, in several different cultures and communities, having being larger can be a sign that you are wealthy, that you have provisions, or you're described as curvy or thick is a compliment, in my community. So what are the reasons that someone might want to lose weight, and not just be happy being big? Is any conversation about somebody even attempting weight loss, is that just fat shaming? And
yeah, so I think it's a great question. I think one of the things is what we get caught up in is this definition of obesity, right? So who has obesity? And of course, I will tell you that it is my strong personal belief that BMI is not the measure of whether or not you have obesity. The actual definition of obesity from the World Health Organization is having extra adiposity or body fat that causes harm to health. So you could live in a larger body and have no health consequences because of it. And honestly, I think that's a different conversation with your healthcare provider about whether you should treat your body size or not, because that's maybe you're losing weight for cosmetic purposes. And I'm honestly, frankly, I don't think we'll ever meet any cosmetic goal we set for ourselves when it comes to weight loss, right? No one wakes up in the morning and looks in the mirror and says, I'm perfect, right? Kind of thing. I mean, maybe there's a few people out there, but I'm not one of them. And I know if I set my goal based on, wanting to look like a Men's Health cover model, I'll probably never reach that goal. But if my goal is more about my health, meaning I can be active, I can move, I can not take medications for obesity-related comorbid conditions, I think that better sets the frame. And so I think we need to stop obsessing about the scale and actually start obsessing about health, right? And honestly, I would love it, and we try to encourage people to do this, is instead of showing your before and after picture when you've lost a dramatic amount of weight, actually show your medicine cabinet before and after, right? So you can actually show the real benefit, which was your health has improved, or show yourself being engaged in a more active activity, not necessarily or something you always wanted to do or loved to do and you couldn't do before, instead of obsessing on a number of pounds. Because if you've met one person with obesity, you've met one person with obesity, right? What may work for you may not work for me. And may not work for someone else. I mean, all of us are so individualized when it comes to this. There is no one solution for everybody.
Two online postings really stuck with me when I was thinking about this conversation, and just GLI's whole approach to obesity, and helping people who have started to have those medical complications, whether it is, fatty liver disease and NASH, which is when your fat accumulation in your liver is, overcoming your body's ability to regenerate and be healthy. I have knee replacements, so I know a lot of folks with, who lost weight to have less impact on joints, and greater mobility. They see my father was able to take himself from, diabetes to non-diabetic, through his, recovering his former athlete, and focusing on goals that were important to himself. But two posts really stood out for me. One was a mother posting her daughters, before and after. She was in a very, supportive and in great way. And I'll, in full disclosure for anybody, who's met me during the past year, it was a Peloton posting. But what I liked and what I commented was, I loved that the daughter's smile was the same in both pictures. So, whether she was heavier, that smile was just really brilliant. And at her, her own self-defined goal weight, it was the same smile. And so that's what I commented on. And that's what I, hope people can achieve. That essentially, they can be their best selves of the same person, and don't lose their joy at either, end of the scale or the spectrum. And
Donna, I think that's important. I just want to emphasize there, just to pick up on that thread, is that, we, like, if you meet somebody within a larger body who's walking down the street today, and you meet them for the first time, we're not too many of us are outside because of COVID restrictions, but when we could be outside and doing these kind of things, and you saw someone with a larger body size, I would just encourage the viewers today not to make an assumption about that person's health or behavior. Because, maybe they weigh 300 pounds today, but a year ago, they could have weighed 400 pounds and have done something really remarkable, which is lose 100 pounds, which is statistically near impossible, but people do it, right? There are exceptions, but it's hard, right? But if you're going to judge them based on their body size, then when they've had such success, we're making mistakes there. So we can celebrate people improving their health and still seeing the same level of smiles. But I think, again, focusing on that body size isn't telling the whole story, right? Because oftentimes we only have to lose 5 or 10% of our body weight to have a health improvement. It doesn't mean you have to lose hundreds of pounds, kind of thing, to be so-called healthy. So
absolutely. And the other post that goes along with this thread in the conversation, was somebody asking, posing to the group, what weight were you when you first thought you were fat? And and I had to smile, because it was like a weight, at least for me, I'll just answer personally, probably like 20 pounds less than what I happily weigh right now. And I remember, like, oh my, woe is me. I weigh this, and I was like, it's not even a goal today, to be that weight. And I think that shift in our own self-image, our own perspective, it was so interesting. I'm really glad that she called us, back to that, to celebrating where we are now, and realizing that, we're so grateful, what we sort of dismissed today. We would, in 10 years, we'll be so grateful for for the troubles of today. And we look back at the past, and we're, running around, eating everything in the world, not gaining weight, and, bemoaning being 110 pounds, like that wasn't even a thing, So just to put it into context, to, level set and bring some, grounding to, what we think about every day, and how we may pick ourselves apart, and rather than celebrating all that we can do, and all of who we are, and recognizing that, as you pointed out.
Right. And I do think, this kind of self-recognition of body size is something that's important to recognize where you are. But I also, again, want to go back to that definition I set earlier, right? I mean, when we're beating ourselves up about our body size, and yet we are still healthy, that's not a useful engagement and activity, right? Kind of thing. I think we are, cosmetically obsessed in this country and in many parts of the world around, this kind of thin norm that's out there. And the reality is, some people who are thin are just blessed being that way genetically.
Right.
And they're actually not, it's not because they work harder or they're a better person than you,
Mhm.
right? Kind of thing. And I think that message is important as well. I do think, I wish someday, and I know it's not possible, but I wish someday we could separate the cosmetic side, the appearance side of obesity from the health side, right? That would actually make our conversations about obesity so much easier. So, yeah.
So we have one of our viewers asking, I've gone to seminars, I get to the point of making an appointment, and I can't get an appointment because my insurance won't cover it. My last attempt was going to an endocrinologist yesterday, so this is very timely for people. He told me I don't have much hope because it's considered cosmetic. Can you talk about that? How? Well, I think it's two questions really, because she asked to talk about how it's not cosmetic for me. I think she understands it. I
Right.
think she knows it's about keeping her liver healthy in this case. But how can we support insurance coverage? I know a lot of work that you have done, and how can we help people make the case to their physician that they should have access to this full array of services that you outlined?
Yeah, and so I think the question doesn't specifically say which service it may be, but I
Mhm.
think the problem in general is something that we face all the time, is that, unfortunately, if you go to your healthcare provider, they usually cannot label obesity as the primary reason why you're there, because oftentimes our insurance coverage excludes obesity, right? There is this general concept that obesity is not a disease, it's a cosmetic problem. And we're working very hard to change that. And we see some insurers adopting better policies. But one of the creative things that happens just in the short term for folks is, remember, for example, if you have diabetes, well, treating, helping you with your weight is actually treating your diabetes as well. So, I mean, we see some creative coding there to help some of these services happen. But I think one of the things that we've tried very hard and we advocate at OEC very strongly for is changing the system to
Right.
really make obesity a
Mhm.
standard benefit. And one of the things that we're doing currently is we have some legislation before Congress just reintroduced a couple weeks ago called the Treat and Reduce Obesity Act that actually looks to change Medicare coverage, right? So basically to say in Medicare, we should cover behavioral coverage, we should cover medications. And by the way, Medicare already covers bariatric surgery. So we
Mhm.
have this full range of therapies in Medicare. And you say, well, Joe, why are we focusing on Medicare? Well, the reality is what Medicare does, the private insurers usually follow. So our goal really is to change the system to make sure that your doctor doesn't have to go through shenanigans with the billing and the coding and actually can list it there for what you have, which is obesity. And I just think that we see some intermittent progress in this area. So if you live in certain states,
Mhm.
obesity care is considered essential, right? But if you live in other states like where I do in the South, or if you live in the South and the Midwest, unfortunately, obesity care is not normally considered standard benefit. But if you live in other parts of the country, it oftentimes is easier. And I would just invite that person who asked the question to visit OEC's website at obesityaction.org and actually submit that question through our Access to Care. We have a reporting tool, and actually one of our folks from our team will reach out and give some more specific advice. So,
That's fantastic. That's why you're called the Obesity Action Coalition,
yeah.
the Obesity Think About It Coalition. And so, GLI, our policy team, we've been very supportive of that legislation and this, whole person approach to care and being able to, yes, code correctly so that you can, personalize all the different elements and tools that are that need to be, available to someone, whether that is talking to a dietitian or a psychologist or or a bariatric surgeon, or even a prescription to a community program. And my husband helped work on the diabetes prevention program that translated and provided the evidence base for the YWC program. And so yes, it's one thing to have these tools existing and developed and these fantastic innovations, but pulling through, connecting them to people, and making sure that the clinical workflow and all the infrastructure and behind the scenes things that enable that are so important. And often it's the sort of unsung work.
Yeah, and I will just say that, I mean, all the services we have for obesity care are underutilized, right? And this is my encouragement to any of your your viewers today is that, if you struggle with your body weight, with obesity, it is okay to ask for help. It is okay to utilize one of these programs. And in fact, they often are designed knowing how complex this is, knowing how alone you might feel, but
Mm-hmm.
knowing that there are other people who have been through similar circumstances. So a lot of the community-based programs include a support system where you have support groups and things like that. Many of them now are offered virtual. And there's lots of things you can do that way. So even from a safety standpoint, because of COVID, and we know that COVID puts people with obesity at much higher risk for complications. So you need to be safe as possible in engaging with this. But I just really want to encourage people to that it's okay to ask for that help. Let's overcome the stigma, right,
Yeah.
of that you have to do this on your own. And there's no reason that you have to address your obesity on your own, just like you don't have to address any other disease on your own. You're a healthcare provider, and the community resources are out there as tools, and you should take advantage of them. So.
I agree, and it shouldn't be trivialized or thought of as just for the weak or or anything. I frequently talk about the fact that I have a virtual wellness coach. I've had for the past 5 years, and we started off rehabbing from an injury, but we talk about just a host of topics to keep even someone as organized and generally on top of things, on top of my health, and I'm prioritizing not just the medical side of an appointment, but really being as healthy and well as possible. But having that coach, that accountability system, that an additional brain to to reinforce the plan and the strategizing about how to actually pull these things through into the course of my life. It's no I not only do not have the remotest iota of shame about it, but I think that everybody would benefit from having some type of coach or somebody on their side, helping them stay on track and achieve their goals, and figure out what's working and what doesn't, what parts of the science apply to you and work for you, and what you should just leave behind. So I think that is crucial to find the type of support and the tools and methods that really are most helpful, and our job as advocates to make sure that they're accessible to.
Yeah, I agree completely, and I just want to remind folks too. I mean, not every program or every coach is going to be right for you, and that's okay, right? I want to make sure people understand is that when we talk about, say, someone going on chemotherapy, we would never say a patient failed chemotherapy, right? I mean, no, the chemotherapy failed them. But when it comes to kind of obesity care, we oftentimes switch gears and blame the person for not doing well on what that program may be, right? And I'll just give an example. So, I get asked to review all kinds of obesity care programs for people. And, one, they called me, and it was a very structured program. This was pre-COVID, right? So Donna, I travel 60% of the time. I'm flying over the world and the country and over the country. And the whole plan was about, pre-prepared meals and bringing your food with you. And I'm like, look, this program doesn't apply to me, right? So don't blame yourself for that. And I went and actually found a better program, right? That actually had someone who was willing to, we could do a little more personalized one, and they customized, and then they gave me tips for how I could better control my nutrition and my activity while I was traveling all the times and things like that. So those programs exist. So I just, again, if it's not working out for you, I mean, give it a little bit of time, but if it's not working out for you, don't beat yourself up. Just move on to the next one, just like we would if we had any other disease. Hey, that blood pressure medicine didn't work. No big deal. We just move to the next blood pressure medicine, right? And just keep the cycle working. And again, don't blame yourself. You don't fail a treatment. The treatment fails you. And so therefore it's time just to move on to something else. So.
Absolutely. Having, married to a geneticist. so that the importance of, not everybody responds to everything, is so important. And, as we work with, I remember even before, the GLI had its 501c3, it was asked to weigh in on, drugs and protected, class status, which are, immunosuppressants and antipsychotic medications and things for mental health and transplantation and things where and so many things. And we're realizing that's really across medicine. It's not one size fits all. It really, not every drug or every innovation or every intervention works for the entire population. And so as we think about personalized medicine as a concept in a field, not just about, targeting a specific biomarker, but really about tailoring everything that we do in health, to the person and the family and the community. I think it's more important, than ever around something that we do every day, which is eat, and holds so many different other, cultural and emotional markers. So really finding out what works for you is more important than I think in any other, field or state.
You mentioning all those medications got me thinking about maybe another string we could talk about. But I think one of the things that's often dismissed about obesity is that, the assumption is you have obesity because you eat too much or you exercise too little.
Mm-hmm.
But I think the data shows probably 10% of obesity is because of medications we take for other health conditions, right? And so, honestly, one of those questions that a patient could always ask their doctor is, hey, I notice you've prescribed me this medication for whatever my health condition is or whatever the circumstances is, and I've experienced some weight gain. Is that normal, and or is there an option that doesn't cause as much weight gain? Because I think weight gain, why people gain weight, is so complicated. It's just not because they ate a Krispy Kreme donut, which I know made the news when they were giving away Krispy Kreme donuts for if you got your vaccine. And I'm sorry, I'll just be very clear that no person has obesity because they ate one Krispy Kreme donut, right? That's not the issue. And so I think we have to recognize how complicated this is. But the medication part of that actually adds complications. And in fact, for a long time, when you actually, or even if you watch medicine ads now today, a side effect is listed as weight loss, right? So as some medications that they give you, and because the FDA thought weight loss was bad, right? And under every circumstance. And in fact, it was okay if a medicine made you gain weight, but not if it caused you to lose weight. And so I think it's important to recognize that it may be stop beating yourself up, which is my main message today, right? Is to stop beating yourself up and talk to your provider and have a frank conversation with them. And by the way, if they stigmatize you, then you go find another provider, right? I mean, if they're engaging in that, because I think many providers don't have the skill set to have these conversations, and if they don't, then they probably don't have the skill set to have conversations with your other health conditions. So probably time to find somebody else. So.
That's very true. So, a couple of things there. So I want to make sure that in the show notes, we not only put the Obesity Action Coalition website, but let's link to a list of those FDA approved that do cause weight gain. I'm on one right now. I'm on prednisone like many patients, and so it has given me a particular empathy, and I've been on it at many points in my life. For my IBD, post-transplant, and different things. And so I at least have the context of, knowing that with the same eating and exercise, habits, the weight would goes up, and then, it's just falling right off as I taper. And it's not because, I have extra moral fortitude, better character, or, am achieving superhero stats in the, on the bike. It's just the medication is changing my body chemistry and metabolism and how I experience things. And so I think, that conversation about obesity as a disease, and when maybe, it sort of becomes a disease for the individual, there may, sort of be a point where, it is in your control. You can, you can just, use some diet and exercise. And then at some point, your body sort of fights you back. I think a lot of, women post-menopause, experience that all of a sudden, something within them has changed. And so the same, diet and exercise habits just don't have the same, effect. And so I think for many people, they find themselves starting to appreciate that they do need to approach this from a medical perspective. They do need that help, because the things that may have worked in the past to keep off excess weight just don't don't work, and it's not that they should feel, you know, ashamed themselves, or that they have this, you know, willpower problem and everything. There are actual changes in their, you know, body's response, the chemistry, the hormones, the metabolism, you know, that can be addressed, you know, medically.
Yeah, I agree. I agree completely. And I think this life stages that people have, and I've seen some interesting presentations where we talk about people through their different life stages. But as someone who's turning 50 this year, I could tell you previously I would go on a diet, and in week one I'd always lose 5 pounds. And by the way, that actually proves to you that the 3,600 calories per pound is garbage, right? Because there's no way I ate less than I ate less than 18,000 calories less that week. But now that I'm approaching 50, you know, that same experience of losing 5 pounds in a week is never going to happen again, right? Kind of thing. If I can lose half a pound, then I would be lucky, right? Kind of thing. And it's just the nature of our work. So yeah.
So, well, it's a glorious. So a few things. You know, you mentioned the, you know, the Krispy Kreme debate. So I want to sort of make a little game called, you know, helpful or harmful to the conversation. So you know, Krispy Kreme debate on you know, on Twitter. I saw, you know, we see doctors from and there were many conversations, but the medical conversations really intrigued me. How doctors from different specialties, whether, you know, internal medicine or palliative, from, you know, from primary care to palliative care, were all weighing in on this with, you know, a totally different, you know, views and expectations of what this, you know, what a donut after you get a, you know, COVID-19 vaccine meant for people. So helpful or harmful conversation?
Yeah, so I think it rose up and became harmful because it let bias raise its ugly head in this situation. Again, not a, you know, a single donut, or, you know, whether that's in the probably, I'm not a dietitian, I'm guessing 250, 300 calories, right? Kind of thing. Is that causing someone to have obesity? And the answer is no. And we definitely need people to get their vaccines, right? I think we want to encourage a vaccination, especially in high risk populations like people that live with obesity. But I think what you saw was this, you know, the ugly head of bias rising up where people that, and I think there's probably room for a better conversation somewhere about, you know, food as an incentive in general, right? And how that might contribute to obesity. But I think this would just be, oh, that's, you know, just frankly, you know, all these fat people are just going to run the Krispy Kreme. That's the only reason they're getting their vaccine, right? And that doesn't help us, right? And in fact, that might actually, you know, further stigmatize someone who lives with obesity and discourage them from even getting the vaccine in the first place. So I think I don't think it was like most bias. I don't think the intent. I don't think it was in. I don't think Krispy Kreme decided to release donuts to make obesity worse or to stigmatize people with obesity. And I don't think the providers may have necessarily think they were stigmatizing people and making the situation worse. But I think ultimately that's what happened. A lot of bias is unintentional, or, you know, you don't realize the harm you're causing when you actually stigmatize someone. And just very clear for your viewers. So if you stigmatize someone because of their body weight, they're going to eat more. They are not going to eat less. So we are not going to shame and blame people into losing weight. Actually, shame and blame, it's documented in many studies, only causes people to gain weight, not lose it. So.
Right. You know, depression is one of the you know, top you know, I don't want to call it complaints because it's so real. It's often not coded in a record, but it's experience. Depression and anxiety are one of the top things that patients with liver disease and with obesity, you know, tell us, and, you know, in communities that goes, you know, underreported, under-recognized, and is a barrier to them, you know, asking for help, you know, being successful on treatment programs. And so I think that, you know, our goal of having this conversation and trying to make the most supportive climate, you know, possible is not just, you know, touchy feely, but it's really core to the success and the goals of these programs.
Right. I think some of the best programs out there for obesity medicine always include that psychology component, because there are a lot of factors, right? I mean, you can deal with the anxiety and the depression that are often complications of obesity. And you could argue, do they come first or they come after? We you know, we can have that chicken and egg argument at some point. But then we also deal with issues as we start losing large amounts of weight or losing some weight. And we may have to deal with some psychological barriers around suddenly how we're treated differently, right? This is something I hear, especially from women all the time, where, no one ever held a door open for me before. Now people are holding a door open for me, but I'm angry about it, right? Because they didn't do that to me before, and I shouldn't have been treated this way. They recognize stigma more as they lower their body weight. And so I think including psychology in this, and again, taking the stigma away from asking for help and asking for psychological help specifically is an important part of our journey in addressing obesity.
Absolutely. And so helpful or harmful shows like, my 600-pound weight loss journey, my 1,000-pound, weight loss journey. Are people watching them to just feel better about themselves, or are they actually coming away with empathy for people's struggles? And so are those types of shows helpful or harmful, and what type of depictions in the media would be helpful in your view?
Yeah, so I see those shows as rather harmful. I just think the nature of them and oftentimes the tone they take. Now, I don't blame anyone for participating in it, but I do blame the producers for the way they market those shows, and they and unfortunately, they lose the old circus show, kind of freak show kind of feel to them that I think doesn't help folks. But I do think we see better depictions in the media. There's a very popular show, This Is Us, that's on right now, that features a character that lives with severe obesity, where I hear from our members that it is actually a more realistic depiction of living with a higher body weight. And so I think we've seen some improvement. And in fact, there are groups even within our community that are trying to work with the Hollywood community, right, to actually better depict people with obesity in TV programming, et cetera. There are a lot of shows that have been on TV in the past. Mike and Molly is another example of one of those shows. I kind of had a love-hate relationship with it because they played into some of the stigma. But in the end, it did show two people with larger bodies engaged in a romantic relationship, right, which was breaking taboos, which you never saw before. So I think we are making progress. But I will argue that shows like The Biggest Loser are another example, right? Again, I don't blame someone for trying that. With that being said, I think the evidence is lacking around that. That's an evidence-based approach. And in fact, the studies seem to suggest most of those people gain back most of their weight. But the way they depict people, there were times like when you're getting bullied in the gym is the same as getting bullied as a child on the playground, right? Kind of thing. And so I'm just wondering what kind of damage they're ultimately doing to folks when people participate in those kind of programs. So.
I don't really recall seeing a reunion show.
So they have done a couple, but actually there's a very good study from the NIH and Kevin Hall who actually studied the people, and it is worth looking at the data because most people did not only regain their weight, but did some damage to their metabolic rate, which makes them actually maintaining weight loss going to be even more difficult in the long run with that much vigorous activity. So, yeah.
So, Joe, this has been a fantastic conversation. I think it is a wonderful complement to the conversation I had last week with Dr. Bill Dietz, who you work with and partnered with for a very long time. And so, to every person who now that spring is springing upon us, and we're getting vaccines out and re-engaging with the world, and who has wants to start a fresh approach to how they maybe approach these issues. I'm so excited to be able to share all the resources that the Obesity Action Coalition has for people, for providers who want to work with their patients, particularly those who also have issues with liver disease, with diabetes, with joint and mobility issues, for which is this so essential and vital, and now we have sort of more tools to understand what's actually happening going on inside, so that people get that feedback and really understand why they're doing this and how it can improve as you pointed out, not just their looks, but their whole health and ability to stay, with their families longer and more active. I'm excited about, continuing to support people on their health journey. And thank you for being on that journey with me today.
No, I appreciate that. And I just really want to encourage your viewers. I mean, I know a lot of us have struggled during COVID. I am one of those folks with my body weight, but if that's okay, right? I mean, I think it's okay for you to actually just recognize that happened. If it happened for many of us, and let's re-engage in our efforts to be our healthiest weight possible. And, and don't feel as if you have to do that alone. Again, we're here to support you at Obesity Action Coalition, and we know there are healthcare providers out there, and we can direct you in the right direction if you can't find one on your own. So just know we're always a resource for you. And Donna, we appreciate all the continued support and our partnership, and we look forward to making sure there's a world where we have better treatments, both for obesity, but for NASH and on all the other associated conditions as well. So,
thank you. And so for more information for this episode, for previous episodes, you can contact us at globalliver.org, find us on Facebook and Twitter at Global Liver, on Instagram, and everywhere you look, and tell us where you need us to be. So thank you today, and stay well and stay connected. Bye-bye.